In terms of urothelial cancer, no game changers this year. There were one or two new pieces of data, so we've seen some more data around antibody-drug conjugates. Of course, we've already seen the enfortumab vedotin data, which were presented last year, showing response rates of around about 40% in heavily pretreated patients, including patients who've had previous chemotherapy and checkpoint inhibitors. We also, this meeting, we've seen the results of another antibody-drug conjugate, early data, but again showing similar efficacy in the heavily pretreated population. So it's a similar concept, of course, a different target, but it does look like this concept of the antibody-drug conjugate may well be an active treatment in urothelial cancers. We also saw an update on the Pembrolizumab trial KEYNOTE-057, which is the trial in high-risk non-muscle invasive bladder cancer, which is refractory to BCG. Now, this is important to us oncologists because we've not treated this disease before, but we need to start skilling up because I think this drug certainly seems to be active in this context. So this is patients who've had BCG and have the study actually has two cohorts. It's got patients with CIS, carcinoma in situ, and patients with papillary disease alone. This is just the CIS cohort. There's an update on data which was shown last year, confirming that ongoing 40% response rate in terms of complete response of CIS. But we've also got now an estimate of the duration of that response. So this is relatively early data. The duration of that response is just over 12 months. I think it's really important that we follow up on that because that's maybe a little bit less than we were hoping for. This is likely to be a regulatory study, at least in the US. So it's possible this drug may actually get early product registration in the US as a treatment for refractory carcinoma in situ. There's lots of other studies going on in this area, but this is the most advanced data we've seen so far.